Welcome to yet another edition. Today we are joined by Dr. Ahmed Barry
From Dubai, yeah.
from Dubai.
Yeah.
Is there a difference between Dubai and UAE?
Yeah, UAE the country and Dubai is the city in that country.
Oh. So today, like I've told you, we are joined by Dr. Ahmed Barry. Dr. Ahmed Barry is a consultant on regenerative medicine and stem cell therapy.
Yes.
Ebigambo bigumu naye nja byogera mbigguse. So Dr. Ahmed Barry from Dubai is here to talk about regenerative medicine,
Stem. It's like a stem, the tree
stem cell.
Yeah.
Wow.
Stems yeah.
Oluzungu lusobola okukwata my blazer n'oluwulira. So let us first look at the background of regenerative medicine.
Yeah.
What is regenerative medicine?
Yeah.
Yeah.
So regenerative medicine is a new and evolving field of medicine in which we treat conditions like before we used to treat it with surgical management. In regenerative medicine is like by restoring the function of the cells and the tissues without surgical intervention. It's mainly about restoring and repairing the damaged tissue rather than replacing.
Operating on it.
Yes.
And replacing.
Yeah.
Oh, so you put cells.
What we do is that we take those stem cells from the patient, from the patient own cells, usually from the bone marrow or from the belly fat. We take cells and then we send it. We having a very specialized technology at the lab. They separate the cells out of the sample we took from the patient. They activate it and then they make it ready
To go where?
Yes, we are specialized in orthopedic regenerative medicine.
Oh.
Yeah.
Okay.
So we are treating spine conditions, joint conditions like the shoulder, the knees, the ankles, the hips. Okay.
So if you have issues with your ankles, you get cells from the bone marrow,
Yes. Then
treat them,
Yes.
then put them where the problem is.
Yes.
So the stems grow again.
That's it.
Ah.
Yeah.
So that's why they were telling, we had a case of Jaden. We had a young man called Jaden.
Yeah.
You saw that?
Yes. He's having I guess sickle cell anemia.
Yes.
Yeah.
So they were saying you can use regenerative medicine.
Yes, but Jaden case is a different case.
Okay.
He needs a bone marrow transplant. Yeah.
Okay.
That one is a different.
It's a different one.
Yeah.
So basically omwami ono ky'annyonnyola agamba regenerative medicine yenzijanjaba we bakwatira cells zo bo bajjanjaba joint, mavivi, hips ebibeera biganye bagenda ne bagenda ku bone marrow yo ne bajjayo cells ezo ne bazikolako ne baziteeka wowulira obulumi oba wogamba nti waafa. So mu kifo ky'okulongoosa ku vivi bo bateekawo cells zo zennyini ze bajja ewalala ne ziddamu ne zikula ne zisanga ziri ne weegatta n'okola ki n'owona. Kati eyo enzijanjaba gye bayita stem cell treatment. That is, I'm trying to put it in Luganda.
Yeah, sure.
So what is stem cell treatment?
Okay.
Yes.
So before we go to the stem cell treatment, we need to understand what is stem cells.
Okay.
So stem cells are a very specialized type of human cells that are capable of transforming into any type of human cells. Okay. Replacing any type of human cells, regenerating cells, and helping cells to regrow. Okay, and develop. That's stem cells. So in stem cell therapy, we use these cells to treat conditions, mostly the degenerative conditions. Okay, so as we are working on the regenerative medicine, so we're working on the degenerative conditions to regenerate the problems. Okay. So problems like spine problems, like low back pain, like disc problems, like knee arthritis, like sport injuries. A lot of problems have been treated with this, with the stem cell therapy. Yeah.
Okay, so now we get to stem cell. Break it down for us.
Yes. Yeah. So stem cell therapy is using stem cells to treat these conditions we mentioned. Yeah.
Okay. So so when someone has issues with the hip, like you've said, we pick those cells
Yeah.
from the stem, the core.
Yeah. We take it from body areas that is rich in stem cells,
Okay.
like the bone marrow, okay, like the fats,
Okay.
okay, like usually the belly fat.
Okay.
Okay, we take these cells and then we process them on the lab. Okay, we process them, we activate them, we separate them from the medium, and then we activate them, and then we bring them back and put them at the area of disease. Yeah.
And with us today, it's a new type of treatment
Yeah.
around the world. It's
Sure.
just picking up,
Sure.
and not so many people have, But with us today, we have a lady who has used stem cell treatment. Yeah,
Yeah.
and we want to invite her here to tell us. Kati ye atagenda kutuyambako kizza mu Luganda. It's going to help us to break down this for us.
Perfect.
In Luganda.
Sure.
Yeah.
Yeah.
So, Madam
Annette.
Madam Annette.
Yeah.
Jango soko twegatteko wano. Kale, nga bwe mbadde mbategeezezza twegattiddwako omukyala Madam Annette. Annette Kayanja. Uli otya? Obulamu bugamba butya? Omukyala ono namusanga wano last week nanyinyonnyolamu ebintu bino ebya stem cell treatment. N'oŋŋamba wagikozesaako. Kati so wagikozesa. Kati gwe sooka ogitunnyonnyole kuba oli abaddewo wano abadde ayogera Oluzungu naye nga ogitegeera. Kati gwe sooka kuba gwe okikozeeko n'olaba bwe kikola. Kati gwe okimanyaako otya stem cell therapy treatment, wagimanya otya?
Mu 2023 nali diagnosed with bagiyita osteoarthritis. Osteoarthritis of the hips.
Yeeriwo eyo.
Obulwadde obwo bukwata amagumba mu hips, mu maviivi, mu mikono ne ku spine. So neefuna mukwano gwange omu yandaba nga ntambula n'emiggo, nga bamaze okukola diagnosis eyo nga bangambye nina kufuna implant, nga disupposed okufuna implant ku kkoso. In the meantime nali ntambulira ku miggo awo Mufti Menke we yabeererayo. So someone saw me na introducing ku stem cell therapy. Stem cell therapy is a kind of treatment nga bakozesa cells okuzizza obujja. Bazizza bujja. Kati my first treatment nagenda Malaysia. Ne bankuba stem cells nga baziggyamu embryo y'omwana. Omwana bw'amala okuzaalibwa ekyo ekisawo mwakulira bajjamu stem cells ne baziprocesinga ne bazikuba. Kati engeri gye ziyamba omwana okukula bwe bazikubamu naawe ezizo zisobola okuddamu okukola ki? Okukula. So those ones zinoonya gye zitambula mu mubiri ne zinoonya awali obulwadde, oba zikuyamba okubuildinga liver, to regenerate the liver, the kidney, the lungs, something like that. So at that time in Malaysia, tezanyamba genda mu joints. Tezanyamba. So when I came back, after some time, that person who introduced me to the stem cell therapy, he introduced me to Dr. Ahmed.
Ono abadde
wano. So Dr. Ahmed yayaze Uganda ng'alina Abasudanese bazze okukulako. So I got the opportunity n'ankebera amaviivi nga gannuma naye nga simanyi nti nno ki arthritis ankutte n'amaviivi, so n'ankolako akozesa ye enzijanjaba eyiye akozesa musaayi gwo n'amasavu go ne bagaprocessinga ne bajjamu cells ne baddamu ne bazikola ki
ne
bazikuba
awali obulumi
mu maviivi. So ne bankuba the first time ofuna treatment eyo emirundi 3, the second time and the third time. It depends on how your body
takes them in.
Yeah. So nafuna my last treatment for the knees last year in November nga akomyewo, so my knees are okay. They are fine.
Tokyali ku miggo?
Siri ku miggo. Siri ku miggo, but nkyalina problem eri eya hips. Kati this coming weekend agenda kunkolako from here at TMR hospital. Agenda kukola ku hips, ngenda kufuna surgery ya hips banteekemu stem cells mu hips kubanga yansaba MRI recently ngeraga nti ngeze ku stage 3 arthritis kati
ku
hips. When ntuuka ku stage 4 definitely mba neetaaga implant. Yeah. So ate implant eri nti after 10 years oba olina okugiddamu, but bw'obanga ofunye stem cells ziyamba bagita cartilage okuddamu n'ekula ku lwayo. That's why they call it regenerative medicine. Ziyamba ekintu okukiza obuggya.
Kati kino kiriko emyaka ow'ensanvu ajja?
Yes, ow'ensanvu ajja. Obuzibu bwokka we buli stage gy'oba otuuseeko. Stage gy'oba otuuseeko, singa oba otuuse ku stage 4
obeera tokyadda
oba kati awo oba ogenda ku maintenance. Bw'obeera ku stage 4 obeera ku maintenance. Naye bw'obanga oli ku stage 1, stage 2, stage 3, it is better. The earlier the better.
Wow, I see. So regenerative medicine for you
kuzza obujja enkola kubanga amavivi gange nali sisobola nga sikyasobola kubendinga but also regenerative medicine stem cells zino zeetaaga nnyo okukolera nga you have a toxic free body.
Ebyo kati
okulya processed food, your lifestyle matters.
Yes,
processed foods, soda, ngano.
Kati gwe tokyabirya?
Sibirya.
Wamma kwe kulabika bw'oti olinga owaffe ate?
Nekyo. No, naye nze nakozesa ne stem cells. Malaysia bampa stem cells eza face, eza anti-aging. Ezo mezikamu zikuzza bujja. Waliwo ezikola ku anti-aging.
Okay. Kale, we have to luli guno eno gwasooka ogingamba ne Dr. Dennis Health Camp egenda beera wano utandise. I think it started today.
It started on
Monday. And it's running up to 2nd April.
Yes.
One era?
Yes.
Where?
Wano
right
now wetuli.
Bano abantu bonna abadde wano obedda.
Bazze kulaba mwami ono.
Oh wow.
Luli abaddewo for some time from November. Nga ze alaba abalwadde era webali abamu abasobola okuwa testimony. People have been cured, emigongo giwonye. Abalina
omukyala abaddewo wano n'agenda.
Angambye ye abadde ne issue n'amagulu n'amaviivi ng'alina pain. She's 70, that lady will go right.
Oh.
Yes. And the advantage ya stem cells ezo bazikubamu they don't only work on the knees, but they find a way into the whole blood. Nezigaba nezikola wano nezigabana n'awalala. Kati nze zange babadde bankuba ez'amaviivi, but nesanga nga ne hips
nazo bazikoze
nga zigenzeeyo
somehow because the cells move.
Kati nagenda okulaba nga nsobola okutambula nga sirina miggo. Era abantu abasinga abandaba beewuunya, how do I move when I'm
like
actually sinabakola surgery ya hips.
Yeah, hips.
I just got the opportunity nti nali supposed ogende Dubai, but then the doctor
yajja eno
najja wano
n'ogamba katumukozese
yes
ku TMR hospital
TMR.
wano enaalya.
Balina ne branch ebbunga.
Naye kyendabye mu byonna abantu abafa balabika kuba beebaavu, kuba omuntu bw'oba olina mu kasente ate arthritis obeera tomuwonye
Oba omuwonye.
Neffe tuli eyo tonywa mata tokola booti buli kimu kiveeko. So nga ate stem cell therapy yiino tambula kilomita 2 sente yo yekweyimirira.
Teweetaaga kutambula nnyingi ezo. You just do some exercises around your home, then you're good to go.
You're good to go.
Bw'oba osobodde n'okusotta kagaali.
Okayine waka okasottasottamu eyali ku miggo.
Nkayina akagaali nkasotta.
Mutyaba tolumwa amagulu.
Naye Kasuku mbadde ngamba naawe oli wa degree.
Ndi wa degree naye oluzungu lwe lugumumu. Kyogamba wa degree abeera alina kumanya buli kimu. Degree yange sigiina mu stem cell. Akagambako kanzannye.
Nkulabye nga kakumenya.
Kanyigiriza nnyo stem cell therapy. Agamba kati nibe kati.
Kakozesa stem cell. The good thing with this nti bakozesa musaayi bo.
So let's talk about the health camp that's happening
this week.
Yeah. Yep.
Yeah.
She's championing it a lot. I met her, I used to make her school, please come, we need to tell everybody about this. So what's going to be happening there?
Okay, so in this camp, we're going to do some treatments, some procedures for patients complaining of spine problems like disc, some people with knee problems, especially people with arthritis, and sport injuries like ACL injuries and meniscus injuries, as well as some shoulder problems, shoulder conditions like frozen shoulders and some rotator cuff tear. So yeah, it's most of the problems we are going to do. We are going to solve in this camp. Yeah.
So that is happening
here at TMR Hospital. It's TMR specialized hospital here in Nadia.
And it's running up to 2nd.
It's running up to 2nd.
Second of
Agenda
April.
paka 2nd April.
So
after 4 weeks, he'll come back. Akoma on reviewing the patients.
Reviewing the old patients and doing the new patients.
Okay. Thank you.
Welcome. Thank you very much. Thank you very much.
So we encourage all Ugandans to come and turn up for this treatment.
Konera ddala ku bantu b'omanyi abatera okufuna ebirwadde ebyo.
Abantu ba sportsi bannina amaviivi, abakyala abali eyo ab'amaviivi n'abaami, mujje omusawo waali wano.
Okuva ssaawa mmeka?
Abeerawo okuva ssaawa 3 paka ssaawa 12 ez'olweggulo. Yes.
That is 9 to 6.
Yes, 9 to 6.
For all those days. Even Sunday.
Even Sunday.
Yes.
You will be here.
Yeah.
Yes.
Because we have a short time. Yeah.
Mujje babajjanjabe.
Kale, tweyanze nnyo tweyanze.
Kale si.